I'm here to pray for the women who have to make the choice whether to keep their own child or to end it. I pray that they never end any life and they give that life to somebody who would want to have that life. There's so many people that want children and aren't able to, and they would love these babies. All these babies need to be loved. A lot of strength, and abortions were becoming very much easier to get and safer, which made them more in number. But now, even though they can be easier to get and they're safer, there are people, more and more people, due to the 40 Days for Life and other organizations that realize life is important. Life is important for everybody. And if you can raise a good child with a lot of love, there's no telling what that child is going to bring to this world.
You know, I have the honor of providing abortion care in several states, Missouri being my primary location, but I also provide abortion care in Kansas and in Oklahoma, and then in Illinois. And I'd say amongst the biggest difference is that in Kansas, Oklahoma, and Missouri, the practice of medicine is really, particularly as it relates to abortion care, is really driven by the state. It's not driven by medical principles or medical ethical principles, or what we know is the right thing for patients. As more and more states pass sort of outrageous laws, like when Texas passes a law, there's a lot of attention around that. But it's the most likely case is that we in Missouri have been dealing with that same law for decades already. So here in Missouri, we have required waiting periods, for example. So when a patient decides that they want to have an abortion, they first have to visit us in person at least 72 hours before they actually have the procedure. You know, we're also in a state where neither public or private insurance pays for this health care. And so not only are we asking patients to take time off of work and find health care to travel all the way to us for that consult visit, then they have to figure out how do they do that a second time, in addition to then paying for that care. Yes, so one of the requirements of the state of Missouri is to provide patients with a booklet of information. This booklet was designed by the state of Missouri, not by physicians or other healthcare providers who provide abortion care. And yes, it includes lots of inflammatory and not medically grounded information about abortion, really truly with the intention of scaring folks or shaming them into believing that this is not a valid healthcare option for them and that they don't know what's best for them. The thing is that women have been navigating the complexities of abortion regulation for as long as abortion has been around, and abortion has been around as long as people have been able to get pregnant. Women are pretty resilient and they will tend to find a way. And for many folks, that means traveling to another state. For other folks, it means borrowing from family or friends or not paying a bill this month in order to be able to navigate that. Sometimes it means losing a job and finding another one because they aren't comfortable telling their place of employment why they need so many days off. So it's incredibly disingenuous and quite ironic, actually, that states like Missouri pretend to be pro-life, but yet there are some very simple things that they could be implementing that would reduce the need for abortion for many folks and really would provide an opportunity for folks to live healthier lives. Yeah. So, you know, the shame and stigma around abortion doesn't just end with the patients who need it, right? You know, you probably saw protesters as you came in through the door, and they know my name and they shout things at me all the time. But I will say this, I am proud of the care that I provide. You know, it is a really unique experience to be able to sit with somebody in what feels like for them a crisis, and in such a short amount of time and with such a simple and safe intervention, be able to hand their life back over to them.